the gynecology and obstetrics. My name is Gilton, and we will start in a moment. Ricardo, are you ready for the opening words?
Yes. Hi, everyone. Good evening. Good afternoon for some of you. It's with a great pleasure that we are all gathered here to another webinar. I hope everyone could turn on the cameras when we are speaking, because I think in this beginning, it's important for us to see all of the faces if it's possible. We'll have this is the third webinar that we are going to produce. This research task force, and Gil is going to talk a little bit about it, has been doing a wonderful job for the past year. We want to continue this work. We want to continue to take the name of acupuncture and ETCM as far as possible. And it's very important for me, for ETCMA, as the Vice President of BC, to showcase the work of these great people that are doing now. I hope you can also go to our Google Drive and you can see a lot of the things that was done in the past. You have infographics, you have things about the different approaches that we have here on the research task force that you can take a look at it and use if you want to. Before I pass the floor to Gil, I just want to say that don't forget that in 2 days we'll have the World Acupuncture Awareness Day. So it's important that you share everything that you can with your friends. It's important that we share that ETCMA, that the acupuncture can change lives, and we all love acupuncture, and we do acupuncture because we think this is the best medicine we can offer to our patients. Thank you for your time. I hope you enjoy, and see you very soon. Thank you. Gil?
Thank you, Ricardo, for the introduction and for the kind words. Let me share the screen so I can present our team. Can you see my screen?
Yes.
Thank you. Just a sec. Okay, so again, thank you everybody for joining to this webinar. I can see some familiar faces from different parts of the world. It's great to have you all here in our virtual meeting. It's important for us that you support and join the meetings and share the content, and your attendance is very much important to us. As Ricardo mentioned, this webinar is being recorded. It will be available in our YouTube channel. ETCMA has a YouTube channel, and as well all the previous contents of our previous webinars are there, so you can find these materials. You can download the presentations and use this information to advocate our profession. Quickly, I want to introduce who we are and the research task force aims. We are a small group of practitioners working together the last 2 years since July 2021. We are motivated to provide relevant research materials and tools in order to inform ETCMA members about acupuncture research. We also want to assist each one of you, our members, to become a better researcher by creating well-written case reports and enlarge our clinical-based databases. One of our first webinar and newsletter was about case reporting. So if any of you has an interesting case report that he wants to maybe publish or write it down in a good way, you're welcome to share it with us. Our vision is to bring research closer to whoever is interested about it, and to get more acquainted with the current research about acupuncture treatment, to promote our profession. and in the end to make our profession in a higher standards and higher level. My name is Gil Ton, and I'm the head of the research task force, and I'm based in Amsterdam, the Netherlands. We have Aram Akopian from Greece, also one of the EC members, part of the communication department. We have Ana Varela from Portugal, and also her colleague Pedro. From the Scandinavian countries, we have Anya and Sari from Denmark and from Finland. And last but not least, we have Mark from the UK. And this is our small group. Today, we also have special guests from Denmark, two master graduates from the master program of Acupuncture Academy in Denmark, Miss Lina and Miss Panel. They will share and present in this webinar today. So the RTF, each year we have 3 newsletters and webinars. In 2022, we had case report, stroke, coronary heart disease. And in this year, we already have acupuncture cost effectiveness, Mark Sebastian, and today gynecology and obstetrics. So we have more plans for 2024. So stay update and keep joining and attending our webinars and share the materials that we provide. So without further ado, I will stop sharing my screen and I will pass the torch to Ana Varela from Portugal. So Ana, the floor is yours.
Okay. Good afternoon, welcome to everybody. I'm going to share my screen with you. So my presentation is about the clinical case report of climacteric syndrome treated with Chinese medicinal formulas. As the case is a long case, I call your attention to the most important facts. And I will do an introduction about menopause, and then I present a case in 3 phases that last 10 years. The menopause is not a disease, it's a significant natural psychosociocultural milestone that is experienced and perceived differently by each woman. The diagnosis of menopause is based in a clinical criteria, and the fertile period of the woman can be divided in 10 phases that I'm going to use to present the case. But I call your attention that the most frequently mentioned menopause symptoms in Portuguese in the metropolitan area of Lisbon are a bit slightly different from the general population. It presents weight gain, psychological symptoms, and sleep disorders more important than hot flashes. So, if you look now to the traditional Chinese medicine framework, we notice that the period arrives when there is a balance and good relation and maturation between the zangfu, the vessels, yin, yang, qi, blood, and yin. And when this happens, the woman can conceive. This is the meaning of Renmei, and can have a direction in his life. Looking now to the classics, and as I told you, the menopause was not a disease, but appear the symptoms related with the Jingguan, which means the cessation of the period. And we saw that the main condition that appear is Zhangzhou, means restless organs or dryness of the junk food, but also psychological distress that was known by Bing because it's a herb that is used to treat psychological distress. So in the modern research about TCM appeared the kidney deficiency as a cause and the pathogens, the not balancing in yang. But I think this modern has to do, this modern research has to do to the influence of the Western medicine in the traditional Chinese medicine. This case, as you see, menopause is not a disease, but in the last 60 years, the life expectancy in Portugal increased to 83.4 years. And a lot of symptoms associated with menopause have increased, which called the attention to the specialists of TCM. So this is, I present this is an influence case for three main reasons. First, apply the research evidence to the clinical patient context. Second, use different combinations of patent Chinese medicinal formulas to, according to TCM differential diagnosis. And last, 10 years, including the pandemic phase. So if you now see the case, is an hyperactive woman that come to the first consulta because of irregular period and irritability. But, you know, we notice that she also have a chronic rhinite and a chronic constipation and also a dry skin with allergical reactions. So if we look to the case and see all the phases, the late reproductive phase, the menopause transition phase, and the post-menopause that I divided in three phases according because of the pandemic condition, we see that in each phase we have done 6 treatments in a period of 6 months, and we apply the formulas according to differential diagnosis. And only in the last phase we have applied questionnaires before and after the treatment. In the other phase, we have taken each consulta the symptoms and the patient fill a form with the intensity of the hot flashes. So in the first phase, where the occurrence, the principal occurrence are this one, we made the diagnosis of TCM. This is notation of ICD-11 and UDCD-11. And the main symptoms presented are liver depression, forming fire, and liver fire invading the stomach, and yang ming. So we have these treatment principles: soothe the liver, relieve stagnation, and calm the fire. We have to use Danzi Xiaoyao, but was not enough, and we joined. What we noticed is that this patient presented also a Qi deficiency and insufficiency of the stomach that don't build enough Jingye. We also find that the lung and the in the Qi and the in of the lung are deficiency, so it cannot nourish the skin or strengthen the Wei Qi. So what we have done is nourishing in the winter period, nourish the yin and yang of the stomach and fortify the Zheng Qi. With that, we could control the regular intake of antihistamines that the patient take, and control the high need episodes, and also the main complaints related to the menopause. In the transition phase, or the phase where the period stopped, the patient presents a normal kidney, liver-in and kidney-in deficiency, and kidney She deficiency. So, but also heart and kidney disharmony. And this pattern was the most important, because the patient present insomnia, but also vexation, internal agitation. So we have to first harmonize the heart and kidney, and nourish slightly, superficially, the in of the liver and kidney, and only after that to tonify the kidney She and fortify the in to stop the loss of air. If you look now to the postmenopausal phase, we notice that after the phase after the cessation of the period, there was no symptoms, perceived symptoms. But with the pandemic, the patient have to work a lot in the computer, with the eyes burning, with the excess work, and all the symptoms aggravated. So we saw that there is a liver young ascendant with the hyperactivity pattern, and the stagnation of liver with damp heat in the gallbladder. So we have to give tiamagutanin and wendantang to resolve this situation. After this phase, there is another situation after the pandemic, because the patient have to take care of a dog with epilepsy and of his mother in court of the death of his father, and there was hot flashes caused by stomachite that uprise and can even have blood in the teeth. So we have to nourish the in of the stomach and redirect the She, and also after that nourish the in and yang of the kidney. As we have done a questionnaire here before and after, as you can see, we can reduce the hot flashes, night sweats, and sweating, as you can see, like vasomotor symptoms. We can reduce in a way very important. We also could reduce the psychological, psychosocial factors, but the physical, the sensation of fatigue is maintained, we think, because as an emotional cause that have to do with the conflict between what patient was used to do before and what she can do in the present circumstances where she has to deal with the familiar condition. So thank you a lot for attending, and I stop my communication.
Thank you, Anna, for the very detailed presentation. Thank you so much. Sari from the north of Europe, from Finland. Please, the floor is yours.
Thank you. I'm going to start by sharing my screen as well. Here we go. I hope everybody can see me. And indeed, I'm going to be talking about obstetric acupuncture safety today. I am a little sick, so I hope that my voice doesn't bother anybody. Before talking about the actual acupuncture aspect to this topic, I'm going to give you a brief overview of the lay of the land at the moment regarding obstetric acupuncture and talk a little bit about the challenges we are looking at when we are talking about obstetric medical studies. So, in general, we are seeing that acupuncture tends to be quite useful and quite used treatment modality for a number of health concerns during pregnancy. Therefore, we are also looking at acupuncture being integrated into pregnancy care as well as birthing cultures. That would say and mean hospital birthing houses, birthing centers, as well as home births. This means that the role of acupuncturists being purely a clinician is a little bit widened, and their role becomes also about informing and educating pregnant people about the potential care that we could offer for them. Therefore, acupuncturists become part of obstetric healthcare as well as part of the treatment plan for the pregnant person. Thus, it's really important that we understand about the aspect of safety so that we have thorough understanding of the types and severity of different potential side effects and adverse effects that acupuncture can cause in these groups of people. Through this knowledge, we can then increase and create evidence-based and informed decision-making processes about our treatments that we can offer. This then again creates treatment transparency that we can then easily communicate with the other healthcare providers working in the obstetric field, and they will be interested in the safety aspects on this field of medicine. Working together with obstetric patients doing research can be really challenging, and there is a lot of considerations that one should be aware of when reading papers, when doing studies, when working together in general with people who are pregnant. And considerations such as ethical and legal considerations should be acknowledged. We are not only looking at the parental well-being, but also the fetal well-being. Not only looking at the short-term health impacts, but also looking at the long-term health impacts of these two people. When we include pregnant people in medical studies, we need to be aware that we're potentially working together with vulnerable populations because of their status in the society. Pregnant people can be also incredibly challenging to work with, as they may present with a number of different health-related conditions simultaneously, which means that they may present with pregnancy-induced hypertension or gestational diabetes or systemic edema. They may also, at the same time, bring through all the other diagnoses and pre-existing health concerns and conditions from the time before the pregnancy ever started. Pregnancy also alters the physiological functions in the body, which obviously may create some indications to the treatments that we're offering and therapies that we are offering. So just to give a quick list of considerations and challenges, it's not surprising that historically pregnant people have been misrepresented and excluded from medical studies in general. However, lucky for us acupuncturists, there are some literature existing regarding obstetric acupuncture safety. And when we are looking at acupuncture or Chinese medicine, we're looking almost like two different branches of approaches. So we have this very traditional acupuncture approach, and then we have this more Western scientific approach to observe the safety. And in the traditional aspect, we would be looking at more like the classically forbidden points, like what points are safe to needle during pregnancy. When again, with the more Western approach, we would be looking at the standardized or semi-standardized point prescriptions as an intervention, and compare that intervention group to control groups like physiotherapy or pharmaceutical products or psychotherapy. when we are looking at the obstetric acupuncture safety studies, safety can be measured and reported as primary or secondary outcome. However, in acupuncture field, we're oftentimes looking at efficacy data. So is acupuncture effective for pregnancy-induced lower back pain? And there they may or may not be mentions about then safety as well somewhere. However, like I said, there are papers, and I'm going to introduce two different studies that report obstetric acupuncture safety as their primary outcome. And I chosen these papers because they are really well cited. They are quite good papers in general, but like I said, there's more. The first paper is a systematic review by Park et al. They included 105 articles, and they aim to summarize and evaluate data regarding potential obstetric acupuncture adverse effects. And they did find that acupuncture does come with potential side effects that are induced by the therapy. Oftentimes, though, they tend to be very mild and transient. Very similar to the ones that non-pregnant populations are also representing. These researchers also estimated incidence rate of acupuncture-induced adverse effects or harms, 193 per 10,000 treatments. And then when they just tightened the scope a little bit to certainly possibly and probably cause that adverse effects by the treatment, the incidence rate was decreased to 131 per 10,000 treatments. These researchers didn't find any severe acupuncture-induced adverse effects, say hemorrhaging or uterine rupture, growth restrictions, nor did they detect any death-leading complications per 10,000 treatments. The second study I want to show is a retrospective cohort study by Moon et al. And these researchers aim to study acupuncture safety during pregnancy, and they included risk pregnancies as well. They had a pretty good pool of data from over 20,000 participants. They divided the participants into acupuncture intervention, and then the control group did not receive acupuncture. They reported outcomes regarding delivery outcomes, so full-term delivery, preterm delivery, and stillbirth. And when they analyzed data, they did not find any significant difference between the delivery outcomes. So these are the types of papers that we are really happy to have. We really thoroughly enjoy reading these papers, and people who are working in obstetric acupuncture fields, these are also the types of papers that we do want to share to the OBs, midwives, etc. They will be interested in these, as sometimes the quality of reporting may not be quite up to the high standard as we've seen here. So we are looking at paper systematic review here by Clarkson et al. And they looked at the quality of reporting on safety of acupuncture, obstetric acupuncture studies. And they noted that duration, type, and non-serious adverse effects were quite often reported. However, there seemed to be a general lack of detail and possibly incomplete reporting of safety data in general. So this meant that some studies would not, for example, mention about needling methods, what the stimuli was like, how many needles were used, what kind of needling methods in general were used and applied. The same thing, interestingly, for example, gestational stage, how far along the pregnancy was not necessarily described in detail in some of the studies. So there is a huge difference if the person is on their 7th week of pregnancy or the 17th or the 37th week of pregnancy. This group of researchers also saw that there was not necessarily mention about plausibility, how likely it is that the harm was caused by acupuncture, or the incidence rate, how often we are looking at these events happening. And lastly, they also made a note that, for example, fetal harm was commonly not necessarily mentioned in the studies of obstetric acupuncture safety. So even though we consider acupuncture, relatively speaking, safe treatment, we do know that obstetric acupuncture treatments do induce side effects and adverse effects. That means that we should continue looking at doing more research on this field of medicine, as it's very important. However, we have to make sure that we are also making research designs that can employ and include pregnant people in them. So I just named a couple different examples, what should be important to think about when we are including pregnant people in the medical research of acupuncture. So I've included all the references presented already in the slides, and I've created additional reading list. It's very short, but just so that you get a bit of an idea. And thank you so much for listening. I will stop sharing now my screen.
Thank you, Sari, for a wonderful presentation. Thank you so much. Our next speaker is Pedro from Portugal. Pedro?
Hi, everyone. Can you hear me? And you can see my screen, correct?
Perfectly.
Good.
Yes.
First, thank you everyone to attend today, and I will try to make room for our guests, so I do a quick presentation. My topic today, it's about primary dysmenorrhea, and the research is about acupuncture and moxibustion. And what is primary dysmenorrhea? Is defined as a painful menstruation in absence of a pelvic pathology and is one of the most common complaints in a young woman. We have the second type of dysmenorrhea that is defined as a menstrual pain resulting from underlying pelvic pathology. So if you are healthy and you are a young woman, we may have primary dysmenorrhea without any kind of other gynecological disease. So the main symptoms will be cramping pain, headache, nausea, tiredness, vomiting, irritability, diarrhea, and overall feeling of discomfortable, and that can really impact and change lives in a young woman. So primary dysmenorrhea impacts the quality of life. Obviously, it's yes, but this study from Fernandez and Martinez et al. Allow us to understand the impact of dysmenorrhea on female university students, and on a sample or 305 female students, there are 76.5% that have a high prevalence of dysmenorrhea. So they apply the Euro Quality of Life questionnaire, and they say they are problems on mobility, personal care, daily activities, pain and discomfortable, and have anxiety and depression. And these situations are managed as normal for pain, like analgesics, and almost do the treatment with the base of analgetics with self-medicated approach. When they have severe pain, they use analgesics, and they use music therapy, massage. And when you see here in this study, that's why I picked this study, is acupuncture. No, not on the mild, not at moderate, not at severe, and just 2 cases do acupuncture. Acupressure, almost a little bit more on severe cases. So I will try to answer why acupuncture can be useful to treat primary dysmenorrhea. And Shetty et al. Set a study in 2018 that will allow us to identify the efficacy of acupuncture in the management of primary dysmenorrhea, a random controlled trial. And we already saw that dysmenorrhea change the quality of life, and a frequent disorder. So in these studies, they find 60 females aged between 17 and 23 years old, and they are randomly assigned to either a study group or a control group. And several acupuncture points were applied during 20 minutes per day, every 15 days, for a period of 19 days. And they assess the baseline at the beginning, then go on day 30, day 60, and day 90. And we have a short table here. First, the points they are used, there are very common points. Kidney tree, you can read it here. I will not go forward here, but all those points are related with heart, kidney, and then we go to earth, like stomach and spleen, and some local points, and the ETCMA point, confluent point, that is bladder 62. The results, apply the visual analog scale for score the pain, and then they use a systematic symptom to based on the 4 points. That is, 0 score means no symptoms, 1 means that only mild symptoms, number 2 exists moderate, and number 3 exists severe symptoms. And when you go to this long table, you have at the beginning the baseline on the study group. When we do acupuncture, they have the mean of 7.29, and the baseline on control line is 7.12. In the end of the treatment on the study group, they have 2.53, sorry, and the pain management on the control group that do not apply acupuncture, after 90 days, the score is the same. Okay, we will have the opportunity to see the table when you review the video. I will not pay much time here because I want to show it presentation till the end. But we can see that the average score after the pain, the number never rise over number 3 because they use a 4-point numerical rate scale to apply it. So the maximum we can find on those tables will be number 3, okay? Because 3 is existence of severe symptoms. On conclusion, acupuncture can be considered as effective as the treatment modality for management of primary dysmenorrhea, okay, for the control of the pain, and other symptoms can be reduced too. You can check the table later. On Ling Shu chapter 73, we can see the disease that cannot be treated with acupuncture may be treated with moxibustion. So let us find out a solution. And there is another study from Biden Liao that is the therapeutic effect on primary dysmenorrhea treated with moxibustion at REN 8 and warm needling at REN 4 and spleen 6. The object of those study was to identify the effect of moxibustion on those points, and the method was they apply warm needle on both groups, on the control and observational group, but they did moxibustion on REN 8. So during the period of 4 cycles. This is to identify the control, the reduction of the visual analog scale. And they say that the results appearing that both the control group and the observational group, the pain were reduced. However, there is no significant difference between the two groups. What means? It means if I do REN 4 and spleen 6 with warm needling, I can improve dysmenorrhea. So I can handle the disease with needle and with moxibustion. If we combine, the further studies will be needed to prove it, but it's a nice way to approach primary dysmenorrhea, because nowadays we need to have a nice management of oral contraceptive on estrogen, because estrogen can improve cancer-related tumors. So we have to pay attention. This is the conclusion. I will just want you to pay attention to a further reading that is a nice study that is acupuncture treatment associated with functional connectivity changes in primary dysmenorrhea, a resting state fMRI study. And based on this study, the fMRI shows the difference of the brain activity through what was Veron acupuncture and Sean acupuncture for primary dysmenorrhea. So this will be my presentation. I suppose I can do it like this, and thank you for your attendance.
Thank you, Pedro. What a great presentation you shared with us. Thank you so much. Last but not least, our guests from Denmark, from the Acupuncture Academy, Lina and Pernille. Are you here with us?
Yes, we are. We're here. We'll just share a screen. And welcome. So we would like to introduce you to our project, which was developed during our education at the Acupuncture Academy. Can you see our screen? Yes.
Yes.
So the project was the effect of acupuncture on the mental health of women undergoing fertility treatment. So my name is Lina, and I graduated as a midwife in 2002. Now I'm working at Majgaard Fertility Clinic. It's a private clinic in Aarhus. And I graduated as an acupuncturist at the Acupuncture Academy this year.
And my name is Pernille. I graduated as a nurse in 2013. And I graduated this year with Lina at the Acupuncture Academy. We start to talk about the mental health. The WHO defines of mental health is a state of well-being. Individuals can realize their abilities, cope with everyday challenges and stress, and they engage in social interactions with others.
So the WHO defines infertility as a disease when a woman has tried to conceive for more than a year without success. In Denmark, every 10th child is born after fertility treatment. Approximately 15% of women experience severe depression symptoms after a year of unsuccessful fertility treatment. Infertility can lead to a crisis and has a negative impact of the mental health. It can result in a range of negative consequences. The women often start isolating themselves from the surroundings. They experience sadness, anger, and often have sleep problems. So our research question is, what effect does an acupuncture protocol have on the mental health of involuntary childless women undergoing fertility treatment?
We had 14 patients received a protocol of acupuncture treatment, in total of 5 treatments. We measured the blood pressure and pulse in each treatment, and their Shen was observed to provide an objective measure along with their own description of their well-being. Shen and pulse, blood pressure will not further be described because we did not observe a clear effect on those symptoms during the treatments. All women completed a questionnaire before the first treatment and 3 days after the last treatment. In the last questionnaire, the woman had opportunity to share their own experiences gained after the treatments.
So here are some of the inclusions. We wanted the women to be between 25 years old to 45 years old, and they have to be childless for at least 1 year, and they must have initiated a fertility treatment process. And we asked them some questions, and the women must answer yes to at least 2 of the following questions. So we asked them about, do you become more or quickly angry? Do you feel more sad more often? Or do you start isolate yourself from your surroundings? And do you experience sleep problems? And all the patients answered actually yes to all 4 questions, except for 3 of them. They responded yes to 3 out of 4. And it was really important that they were not undergoing or starting other alternative treatments, and they must not have a mental disorder for which they were receiving medication, such as anxiety or sleep disorders or depression.
So we had made a needle protocol. The acupuncture protocol is based on TCM acupuncture. The specific points, the specific actions of individual points and their interactions. And the point we used were MS5, heart 7, liver 3, lung 7 at the right side, and kidney 6 at the left side, and stomach 36. And these were the points we used in all treatments in all the women.
So we asked them some questions, and the first question here is about anger. And we asked, did you experience getting angry or getting angry more quickly about things you don't usually get angry about? And you have to focus on the blue. Before the treatments, there were 8 out of 14 who experienced anger half of the time, most of the time, or all the time. And after the treatments, there was only 1 person remained angry half of the time. So we consider it as a good result that now 13 patients would report being angry only some of the time or never.
Then we asked, do you feel sad more often? Before the treatments, 10 out of 14 experiences sadness half the time or more. After the treatments, only 3 persons remain sad half the time or more. So we considered it as a good result that now 11 patients only reported being sad some of the time or never.
And then we asked them about the isolation. So we asked, do you isolate yourself more from your surroundings? And before the treatments, there was 11 out of 14 who isolated themselves half of the time or more. But after the treatments, only 2 persons remained isolated half of the time. So we consider this as a good result that now 12 patients reported that they were isolate themselves only some of the time or never.
Then we asked, do you have sleep problems? Example, difficulty falling asleep, interrupted sleep, or waking up frequently and not being able to fall back to sleep. Before the treatments, 9 out of 14 experienced sleep problems half the time or more. After treatments, only 3 persons had sleep problems half the time or more. So we considered it again as a good result that now 11 patients report that they only have sleep problems some of the time or at no time.
So here at the last one is the overall results. And once again, if you look, we would like all the column to be blue. And we have divided the column into two. So the blue, they represent never or some of the time, and the red indicate half of the time or more. And we find it concerning that the women have marked half of the time or more, because it has a negative impact on their mental health. And we consider it is as a positive result, since there has been a good improvement in the women's anger, the sadness, isolation, and sleep problems. In addition to these positive results, the women themselves have provided statements that we would like to share with you here.
My thoughts aren't as dark anymore, and I started to be more social.
I become better at handling stressful situations.
I wish that the 5 treatments were included in the package when undergoing fertility treatment.
I feel inner peace, more present and clearly in my thinking. I also feel more grounded.
So our conclusion is it appears that an acupuncture protocol with the points MS5, heart 7, kidney 6, lung 7, stomach 36, and liver 3 has a positive effects on the mental health of women undergoing fertility treatment, addressing issues such as anger, sadness, sleep problems, and isolation. Sorry.
And so where is the women now in the fertility journey? I know all the patients because they have all been at my fertility clinic. And out of the 14, the 7 of them received a positive pregnancy test. And among those 7, 4 have an ongoing pregnancy now. One of them had before experienced 7 spontaneously miscarriages before this treatment. And the remaining 3, they underwent a scan in week 8. A fetal heartbeat was detected, but the pregnancy ended a week later. But they have not proceeded this far in the pregnancy before.
So thank you for your attendance.
Okay. Wow, Lina, Pernille, what a great presentation. Thank you so much for joining us today.
Thank you.
Thank you.
Okay, so we have 60 participants in the audience. Anyone has any questions for our speakers? Anyone? Okay. Lina and Pernille, can you share with us more? I think first of all, we had a very interesting a webinar. First, Anna presented a case studies about the use of Chinese herbal medicine in menopause. Menopause obviously is very common to see in the clinic. And then we had Sari's presentation with the safety of acupuncture in obstetrics treatments. Also very useful and important for us in order to know the safety of our treatment when we offer it to our patients. Then Pedro shared with us several papers about the use of acupuncture in primary dysmenorrhea. So this is also very common to see in the clinic, to see women with menstrual cramps. And last, our guest from Denmark presented the use of acupuncture for the mental health undergoing women who are undergoing IVF treatments. So very varied webinar. All of those topics are quite common to see in the clinic. Lina and Pernille, you want to share a bit about your acupuncture protocol, specifically maybe to explain about it, because you had some kind of an
There's a question
observational
for,
study with this
Pedro.
group.
Oh, can you
Repeat the last thing you asked?
Yeah, maybe you can share with us about the selection of the acupuncture points that you used and why you used the scalp acupuncture point.
We wanted to do it, make it simple, because our colleagues from the fertility clinic or other clinics should be able to do the same easy protocol. So we found some acupuncture point that could help with all the things we wanted to change. But we also would like to use points that could help them to get pregnant. So the mental health was, of course, the most important thing, but if we could see a difference in the pregnancy rate, that will be interesting as well. So the MS5 is it's a good it's a good point to for all the gynecology's problems, and it's also good for sleep problems and the men, Shen, and the mental, just all mental health.
We have actually two more questions. So one is for Pedro and one is for Pernille. I can read the question for Pedro about the primary dysmenorrhea study. At which time of the in the cycle was the acupuncture applied?
The direct question about is the treatment was performed by 15 days. So it will go one more than one phase of the cycle.
Thank you. And Pernille, which point is the MS5 that you refer to in the study?
It's from due 20 to due 21. I didn't know.
In which channel is it?
I don't think in English.
Oh, the grooving
Governing vessel.
governing vessel. Yes.
Yeah, governing vessel. Sorry.
Okay. Any more questions in the chat?
These are only those two for now.
Okay. So we finish on time. 1 hour webinar about gynecology and obstetrics. Thank you so much, everybody, for attending. And thank you all the presenters from the research task force and our guests from Denmark. And yeah, continue to treat women and men, children, and everybody in the clinic and spread the powerful effects of our wonderful profession. Okay.
I want to say that as I put the questionnaires in the bibliography, there are a lot of people that answer and put more questionnaires that are have done to this to menopause problems, and I want to share after this information if you think it's okay.
Okay,
Sorry.
Anna.
Sorry.
Thank you for your comment and for the very detailed presentation. Anna's presentation has a lot of citations and information, very useful information if you are planning to use Chinese herbal medicine for menopause. So thank you all again for joining, and see you in Research Task Force next webinar. Okay?
Thank
Thank
you.
you. Bye-bye.